here at the 2019 Injury and Disability Scheme Seminar with our keynote speaker, John Walsh. Thanks for joining us.
Thanks, Stephanie. No problem.
John, you mentioned that the role of actuaries in schemes has been validated and consolidated over the last 30 years. Can you tell us what can actuaries do to ensure their role is most valuable for outcomes and in ensuring effectiveness in schemes for the next 30 years?
I think, Stephanie, I would start with thinking about what data we collect as accident compensation schemes. For a long time, we've collected mainly participant input data and financial data and utilisation data, but not so much outcomes in the longer term. So I think as actuaries, if we talk with our administrators to expand the data collections to include outcomes, we can then add that to our analysis set and include it in our longer term success forecasts.
Great. And John, can you extrapolate a little bit more on what you mean by outcome measures?
There are lots of internationally well-normed outcome frameworks. I mentioned in the talk the short form 12, which is a health outcomes framework, but it does cover areas like mental well-being, physical well-being, and general feeling. And I think even something as short as that, which takes only 5 or 10 minutes to administer, would provide us with a lot more information.
Sure. What was the point you were making about being careful about making policy statements without knowledge of operational workings?
It is very easy to look at a policy system from an actuarial viewpoint, which is largely a higher level analysis of the available data that we have, without knowing the processes and pressures that happen within the system. So I think as actuaries, we need to get much closer to the coalface to understand actually what happens in systems before we start providing high-level policy solutions to them.
How are actuaries proving their worth in the NDIS?
I think the actuarial section of the NDIS is one of its most critical sections. It is new to public policy in the Commonwealth Public Service, so it's taken us a long time to, achieve the recognition of the value that we add. But that's happening strongly now. The actuarial team has expanded and really does a huge amount of analysis and reporting, which is now becoming public, on the success and outcomes of the scheme. It's a critical part of the structure of the National Disability Insurance Agency.
Great, and I believe we'll hear more about the NDIS shortly. John, you've been coming to conferences like this for a long time now. Why are they valuable?
This is the first one I've been to for about 10 years, and it's been gratifying to see the change in tone of the conference. They're valuable, of course, because they bring together actuaries and administrators from around Australia and health professionals to take a whole person view of the schemes, if you like, and also of the clients of the schemes. So I think they provide a forum to share ideas, share research, share viewpoints and attitudes, and that can only be good for achieving the outcomes that I spoke about for injured and participants and people with disabilities.
Thanks so much, John, for speaking to us.